If you're on traditional Medicare or planning to retire soon, what I'm about to tell you could literally be the difference between getting immediate health care and waiting weeks for approval. The government just announced a massive change to Medicare that could affect millions of retirees starting in 2026, and most people have no idea it's coming. I'm here to break down complex retirement topics into simple terms you can actually use. By the end of this video, you'll know exactly what these Medicare changes mean for you, which states are affected first, and most importantly, what you can do about it right now. So stick around, because this information could save you thousands of dollars in weeks of waiting for critical medical care. Let's start with the basics. For decades, traditional Medicare has been the gold standard for retirees because it rarely required something called prior authorization. Think of prior authorization as asking permission before you can get medical care. Here's what's changing. Starting in January 2026, the Centers for Medicare and Medicaid Services, or CMS, is launching a pilot program in 6 states that will require prior authorization for certain traditional Medicare services. And here's the kicker. They're using artificial intelligence to make these decisions. Now, if you're thinking that doesn't sound too bad, let me put this in perspective. According to the American Medical Association, more than 90% of physicians say prior authorization has a negative impact on patient outcomes. We're talking about delays in life-saving treatments, increased paperwork for doctors, and ultimately, you waiting longer to get the care you need. Let me paint you a picture of what this could look like. Imagine you need an MRI for back pain, or your doctor wants to prescribe a specific medication. Under the old system, if you had traditional Medicare, you'd typically get approved quickly. Under this new system, you might have to wait days or even weeks while an AI system reviews your case. And here's what really concerns healthcare experts. Medicare Advantage plans, which already use prior authorization extensively, processed nearly 50 million prior authorization requests in 2023 alone. Of those, 3.2 million were denied initially. That's a 6.4% denial rate. Even more troubling, only about 12% of people appealed those denials, even though 82% of appeals were successful. This tells us 2 things. First, the system denies a significant number of requests. Second, most people don't know how to fight back when they're denied. The pilot program is starting in 6 states. What we do know is that this is being called the WISER model, and it's designed to reduce what the government calls fraud, waste, and abuse. But here's where it gets political and personal. House Democrats are fighting back hard. Representatives like Susan Delben from Washington and Ami Bera from California have written letters to CMS Administrator Dr. Mehmet Oz, calling this profit-driven healthcare and demanding the program be canceled. Meanwhile, Senate Republicans are pushing for broader Medicare reforms to cut costs and modernize operation. They're looking at everything from duplicate payments to contractor practices. The bottom line, you're caught in the middle of a political battle that could directly affect your healthcare access. So what can you do about this? Here are your action steps. First, find out if you live in one of the pilot states. Contact your Medicare plan or check the CMS website for updates. Second, understand your appeal rights. If you're ever denied coverage, remember that 82% of appeals are successful. Don't just accept a no. Third, document everything. Keep records of all your communications with Medicare, your doctors, and any prior authorization request. Fourth, consider your Medicare options during open enrollment. If you're in a pilot state and concerned about delays, you might want to compare Medicare Advantage plans in your area. Though remember, they already use prior authorization extensively. Finally, stay informed and engaged. Contact your representatives if you're concerned about these changes. This is your healthcare we're talking about. Financial experts are calling this exactly what it is, a profit-driven decision that puts administrative efficiency ahead of patient care. As one expert told me, profit motive and patient care mix about as well as oil and water. The reality is, this pilot program may expand nationwide depending on how it goes in these initial 6 states. That means even if you're not affected now, you could be in the future. The key takeaway? Stay informed, know your rights, and don't let bureaucracy stand between you and your healthcare. If this video helped you understand these changes, hit that like button and subscribe for more retirement planning updates. And remember, knowledge is power, especially when it comes to protecting your healthcare in retirement.